Bronchitis is an inflammation of the bronchial tubes, which are the airways that carry air to and from your lungs. These tubes play a crucial role in your respiratory system, ensuring that oxygen reaches your lungs and carbon dioxide is expelled. When these tubes get irritated and swollen, it can cause difficulty breathing and discomfort. This inflammation can be triggered by various factors, including infections, pollutants, and smoking. One of the telltale signs of bronchitis is a persistent cough. This cough can last for several weeks and may worsen at night or with physical activity. This cough might bring up thick mucus, which can be clear, white, yellowish-gray, or even green in color. The color of the mucus can sometimes indicate the presence of an infection. Other common symptoms include chest congestion, wheezing, shortness of breath, low-grade fever, and fatigue. These symptoms can vary in intensity and may affect your daily activities. If you experience these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can help prevent complications and improve your quality of life. While bronchitis can be concerning, understanding the different types and their causes is crucial for effective management and prevention. Acute bronchitis is often caused by infections, while chronic bronchitis is usually linked to long-term irritants like smoking. Bronchitis is generally classified into two main types, acute and chronic. Understanding these distinctions is crucial for both patients and healthcare providers. Acute bronchitis is a short-term condition, often caused by a viral infection, like the common cold or flu. It usually comes on suddenly and can be quite severe, but it typically resolves on its own. It's essentially an inflammation of the bronchi that typically lasts for a week or two. During this time, patients may experience symptoms such as coughing, wheezing, and shortness of breath. Chronic bronchitis, on the other hand, is a more serious, long-term condition defined by a persistent cough that produces mucus for at least 3 months a year for 2 consecutive years. This condition can significantly impact a person's quality of life. This chronic inflammation is often linked to smoking, exposure to air pollution, or other irritants that damage the bronchial tubes over time. These factors contribute to the ongoing nature of the disease. Understanding the differences between acute and chronic bronchitis is vital for determining the appropriate treatment approach and potential contagiousness. Proper diagnosis and management can help alleviate symptoms and improve patient outcomes. Acute bronchitis, often triggered by viral infections, is indeed contagious. When someone with acute bronchitis coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can infect others if they are inhaled or come into contact with their nose or mouth. It's worth noting that not everyone exposed to the virus will develop bronchitis. Factors like overall health, age, and previous exposure to the virus can influence an individual's susceptibility to infection. Given its contagious nature, it's crucial to take precautions to prevent the spread of acute bronchitis, especially during cold and flu seasons. Section 4. Chronic bronchitis, a non-contagious condition. Unlike acute bronchitis, chronic bronchitis is not contagious. This is because it's typically caused by long-term exposure to irritants that damage the bronchi, rather than a contagious infection. While chronic bronchitis itself cannot be spread from person to person, it's essential to remember that some underlying causes, like respiratory infections, can be contagious. If you have chronic bronchitis and develop a cold or flu, it's still important to take steps to prevent spreading the infection to others. Managing chronic bronchitis involves addressing the underlying causes, such as quitting smoking and avoiding environmental irritants, as well as managing symptoms with medication and lifestyle modifications. Section 5. Preventing the spread of acute bronchitis, practical tips. In this section, we will discuss some practical and easy-to-follow tips to help you stay healthy and prevent the spread of this respiratory condition. Preventing the spread of acute bronchitis involves simple yet effective measures that can be easily incorporated into your daily routine. Frequent hand washing with soap and water is crucial, especially after coughing or sneezing. Make sure to scrub your hands for at least 20 seconds to ensure they are properly cleaned. If soap and water aren't readily available, use an alcohol-based hand sanitizer. This can be a convenient alternative when you're on the go. Covering your mouth and nose with a tissue or your elbow when coughing or sneezing helps contain the spread of droplets. Dispose of the tissue immediately and wash your hands. Avoid close contact with others, especially if you are feeling unwell. Maintaining a safe distance can significantly reduce the risk of transmission. If you have acute bronchitis, staying home from work or school can help prevent spreading the infection to others. Resting at home also aids in a quicker recovery. By adopting these preventive measures, we can collectively contribute to a healthier environment and reduce the transmission of acute bronchitis. Remember, every small action counts in keeping our communities safe and healthy.